Hello and welcome to our Administrative Grand Rounds, which is titled Women in the Healthcare C-Suite. This event is sponsored by the WVU Master of Health Administration program and the graduate chapter of Upsilon Phi Delta, which is the Honorary Society of Healthcare Administration. This event qualifies anyone attending for one ACHE education hour, and I'll mention that again at the end and how to follow up. My name is Sarah Woodrum, and I'm the Senior Associate Dean here in the school. Thank you for taking the time to join us today. We're scheduled for 1 hour, and there's a lot to cover, so I'm going to dive right into our topic of women in the healthcare C-suite. Women represent 70% of the global healthcare workforce. However, only 31% of healthcare organizations are led by women, and only 20% of those organizations' board chairs are women. In the United States alone, the healthcare industry workforce, which includes hospitals, health services, and social assistants, is close to 78% women. So what this means is that although women make up the vast majority of the healthcare sector workforce, they are considerably underrepresented in executive roles. It is a fact that women do not advance to CEO jobs at rates that are equal to men, even if they have higher levels of educational attainment in the field. Having senior leadership of your organization that reflects the people you serve is very important, which includes not just gender, but also other things such as race, sexual orientation, and many other factors, and they all matter. Having the diversity in gender is particularly important in hospitals, health systems, and physician practices, because women make up a large amount of the patients, and research has shown that women are the primary people who make the decisions in healthcare households. They generally decide which doctor they're going to see, which hospital to go to when people need care in the household. All of these challenges faced by healthcare organizations today require more of a diversity in leadership. Organizations that can more successfully attract and retain top talent women executives have an advantage over other organizations in the same market. For all of these reasons, I'm thrilled to be moderating this panel as we hear from two very successful women leaders in healthcare that have spent a large part of their careers in the C-suite, and we can all learn a lot from them. I'm going to introduce our speakers, both Karen Bowling and Gail Marsh, that are on the panel, and give a very brief background on them because I want you to hear from them. That's why everybody is on here today. Karen Bowling serves as president and CEO of Princeton Hospital. Prior to being named to this position in 2021, Ms. Bowling served as executive vice president of government affairs for the West Virginia University Health System and president and CEO of WVU Medicine's Braxton County Memorial Hospital and Summersville Regional Medical Center. Prior to joining the WVU Medicine System in 2017, Ms. Bowling served as cabinet secretary of the DHHR and shepherded an expansion of the state's Medicaid program at that time. Before that, she's held a variety of direct clinical care and leadership type positions in healthcare and education. Karen has served in various leadership roles, including as chair of the West Virginia Hospital Association, and has been a board member of many other organizations. Gail Marsh, our second panelist, currently serves as a senior advisor to corporate, higher education, and healthcare boards, presidents, and leadership teams in the area of strategy. Her expertise enables organizations to set strategic goals and actionable plans that improve operational and financial results and align the vision and culture across an enterprise. Her additional support as a leadership coach, it complements the strategic work of CEOs and leadership teams advancing their organization strategy. Ms. Marsh is the former senior vice president and chief strategy officer for The Ohio State University. In this role, she led major strategic initiatives, the development of strategy, and a comprehensive strategy management office for one of the largest nationally recognized research universities in the country. She established and implemented strategic financial and facility plans. She developed Board of Trustees scorecards for all major areas of the university, the colleges, and the healthcare enterprise to advance university objectives. In 2020, she led the university's emergency response team for COVID and helped with the development of plans for a safe and healthy return to campus. As you can see from these brief bios, we have a lot to learn from both of these very successful executives. To begin the session, I'm going to ask each panelist to speak for no more than 5 minutes and just tell us about themselves. They can tell us about their professional journey in order to give all of us a perspective on how they got to where they are now. I hope they will include anything else they think is important for us to know about them, outside of what I already said, of course. I then have some questions that I will ask them, and hopefully we'll have time for questions near the end of the hour. So I'm going to go ahead and get started. And first, we're going to start with Karen Bowling. Karen?
All right. Thank you, Sarah. And really thank you for the opportunity to be here. I really enjoyed talking about the pathway, my pathway in particular to the C-suite, because I think it hopefully will inspire others to see this is where you can start and this is where you can land. But you have to really be sort of thinking about, what do you want your pathway to be and how do you get there and set goals. I started with an associate degree, which I think is pretty interesting. I'm a nurse by background, so my first degree was an associate degree in nursing from Bluefield State College. And so I have a clinical background. And I would say that I didn't say at the very beginning I want to be a CEO, but I would say that I always felt that leadership was important and that I wanted to lead in the healthcare field because enhancing the health and well-being of people really is sort of part of the nursing philosophy. And I think that as I grew in the nursing field, it helped me to see that, there is a piece of nursing that you can bring to the C-suite that really enhances your capability as a CEO and a leader. I started in a very small rural hospital, not in a big academic medical center. And as I moved up in that small rural hospital, I realized quickly I needed to continue my education. So I moved on and received a bachelor's degree and then a master's degree from WVU, all in nursing and primary health care. And I served in a variety of leadership positions in the hospital setting. I worked as a nursing supervisor. I worked in various clinical departments. But part of my strategy to be able to be a leader is to understand what happens in the healthcare world. And to understand it, I thought it was valuable to learn different aspects of the healthcare arena. And eventually it led me to looking at education, higher education, and wanted to explore whether or not teaching would be the right strategy for me. And is that the field that higher education that I wanted to go? And so I did teach nursing for quite a while and then realized I loved to teach and it was fun, but I thought I could have really the most impact on the healthcare world in general if I continue to move up the leadership through education and also training. And so after I received my master's degree, I did go back and do some additional training. I'm a lifelong learner. So if I have one piece of advice, it's going to be to continue to do that in your world, whatever you want to do. That lifelong learning is going to be key because healthcare changes rapidly. And you have to always be on your toes in the ability to lead in a healthcare, whether it's any kind of healthcare environment. I think you really have to educate yourself and understand the new trends that are going on in the healthcare arena. When I first started in leadership, I worked as a chief nursing officer. I really liked that role, but I also felt like that I needed to expand my knowledge. If I was going to be in an administrative role, all my educational background was in clinical. So I was fortunate to participate in a postgraduate healthcare administration program. It was sponsored by the AUPHA, which is an Association of Universities of Public Health, as well as the company that I worked for. I was selected to be in that program. It was a year-long program where I received a fellowship certificate in healthcare administration and that allowed me to learn a little bit more about the financial end of the healthcare world, to understand things that, you know, in the clinical world, we knew about, but we didn't totally understand all the aspects of it. And I gained that knowledge through that fellowship program. Once I completed that fellowship program, it put me on a pathway to be a chief operating officer, and then move into being a chief executive officer of a hospital. And so I think that for me, it was really important for me to realize, if I stayed in the clinical role, and I also received a nurse practitioner certificate during the time that I was educating myself in the clinical world, that there was going to be a choice. Either had to move into the clinical role and stay there and advance my knowledge and education there, or I had to move into the clinical role. And for me, because or the administrative role appealed to me, because I felt like I could make a bigger difference in the administrative role. One thing that inspired me when I worked as a nursing supervisor is I used to call the administrative person on call when there were issues at the hospital that needed some guidance. And I learned quickly they normally couldn't guide me. They listened to me and I provided the advice. And that made me think, well, really, maybe I should be in that role and be able to give support and advice to the people on the ground doing the work. And so as I moved through my career, whether that was in the CEO role or the COO or the CNO role, I felt like that being an administrative person in the C-suite and understanding the needs of all the healthcare workers, I was effective because of that understanding. And then moving into the governmental sector and working as a cabinet secretary, that's another story. I'm certainly open to ideas and thoughts about that and answer questions, but that came just because of my reputation, my abilities, what I've been able to accomplish in the CEO suite. The governor did reach out to me and asked me to be a cabinet secretary for the Department of Health and Human Resources. And I took on that role because of my dedication to the state of West Virginia. And again, because of my willingness to sort of step into new roles and educate myself and move forward. And then with WVU Medicine in my current role as a CEO again. So that's a little brief history of my career pathway, from the associate degree to the master's degree to the postgraduate fellowship and into my current position now.
Karen, thank you. I think as the people in the audience hear you and Gail Marsh both speak, they're going to understand how different your backgrounds are, which is what I really, really like about this panel. And I can tell you from having been an off-shift administrator for a couple of years in a previous life at a hospital, we did rely on chief nursing people immensely to get things done. So I can see where meshing the two skills is ideal. I want to turn it over to Gail Marsh now to tell us a little bit about herself.
Thanks so much, Sarah, and thanks for the invite. I'm so honored to serve on a panel with Karen. Karen, your intro was so impressive. So honored to sit next to you on the panel. I grew up in Dayton, Ohio, have lived in Ohio for almost all of my life. Very large Catholic family. I was given one choice, and that was to go to Ohio State for undergrad. I love children, did a lot of babysitting. So I thought, like a lot of people that have gone and gotten their MHA, that I might want to be a pediatrician. And at Ohio State, I started down that path and quickly realized it really wasn't for me. And so I gravitated towards health information management, intrigued by the idea of electronic medical records. I don't like paper, I don't like clutter. And so it was really the perfect transition for me to go into a health management field. Came right out, and unlike many folks these days, was put in charge as one of the directors of health information management. I mean, I was 22 years old. I had 75 people reporting directly to me, no supervisor. I was completely unprepared for that management task that was given to me, and quickly realized that unless I got more education, either an MBA or an MHA, I wasn't going to have the skill set or be able to get the roles that I was interested in. And so got the MHA at Ohio State and having lived there all my life, I left and did a fellowship out at UCLA in California and loved it and said, I'm never going back to the Midwest. But a friend called me and said, we need some help. And how about you just come back for a 2-year contract? And that was in the 80s, and have been at Ohio State up until the last couple of years. All the while in different jobs, 8 or so different jobs. So I think a lot of young people, I know my kids these days, say to me, how could you stay at the same place for 30 years, right? But it wasn't about the same role. It was about a new opportunity every time we turned around. And one of the questions I get on these panels all the time is, how did you end up in the C-suite from that one role that you started with? And my answer is really very simple. I was able to solve the problems that the organization had. So, one of the first ones, it's not new to the young folks these days, but this new reimbursement system was coming out called DRGs. Nobody understood it. Nobody wanted to understand it. And so I just dove right in. And time and time again, if there was a problem, I wanted to be the one to solve it. And so what happens was, it wasn't about getting promoted. It was about solving the problems. And when you do that for an organization, then you're seen as someone that can make a difference. And the promotions come, they follow. You don't go after the promotions, you go after the problem solving. So the first half of my career, all operations, all of the typical professional services, quality improvement, performance management. Then the second half of my time, all in the medical center there at Ohio State, what had to do with strategy and performance and network building. And so spent a lot of time then helping the operations folks realize their goals and their performance incentives to grow Ohio State. And many of those related to network growth. We even dabbled a little bit into moving into West Virginia for some of the patients that were there. I'm so sorry to say now. So, but part of the job. And then as I was wrapping up my career, thinking, I just really wanted to continue with some of the community boards I was on. Opportunity came from the Board of Trustees at Ohio State to implement strategic direction that they had been working on for a couple of years. So like many people know, if you do a strategic plan and you don't execute it, it's a waste of time. So for the last 3 or 4 years, I helped the university grow the higher education goals. And again, as I was about to leave, was asked to lead the COVID transition team to help students get back in the autumn of 2020. So that was my last hurrah at Ohio State. And now I'm spending a lot of time doing leadership coaching. And you'll hear, as questions are posed, that in my mind, it's not necessarily only what kind of leader should you be, it's really what kind of person should you be. So with that, I'll turn it back to Sarah.
I like that, Gail. Thank you. That's definitely a good way to end that, and something to think about. I wanted to start off with a question that just hearing both of your backgrounds, it's a lot, and I'm sure you were very busy. And I know you both have families. Karen, maybe you can tell us what previous experience kind of equipped you with the necessary skills to successfully be able to balance your work with your personal life.
Well, that's a great question. I get that a lot. And I would say early in my career, I didn't do it very well because I didn't know how. I'm not sure I was sort of driven to be successful and to, get the job done. And I love what Gail said about problem solving, because that's exactly what I did. I was the go-to person, the problem solver. And what happens is it goes back to Mikey will do it. Well, when you put your name, Karen will do it, then you become pretty successful getting a lot of work and you have to complete that work. And I learned that, I would take things on even when I shouldn't take them on, because I already had, 5 other projects that I needed to do. It was early in my career. And I think, for me, the balance came when, one of my I have two children, a son and a daughter, but when my son said, Mom, you know, you usually come to all the games and you missed 2 games this year. What happened? Well, 2 games, you know, to anybody else that may not seem a lot, but when every other year I'd attended every game, it dawned on me that those were things I needed to balance. And so I learned it. I think, you know, my children taught me the need, and then I taught myself how to go about saying no, that sometimes it's okay to say, look, I've got 5 other projects, happy to help, but I can't be in charge. And that helped me balance the rest of my career when I knew that there had to be a limitation to what I was capable of doing. Then if I took on too much, sometimes you didn't give enough time and energy to every single project, and it really could hurt you rather than help you. And so I think that my lesson was balance is important, and you have to figure out in your life what you can do to create that balance. And for me, it was learning to say no.
Thank you, Karen. I have a feeling, well, I know I can learn from that lesson, and I know a lot of people probably on this call can as well. And I think thinking about the part where it can hurt you, not help, is a very important aspect of it. Gail, you also, I know, have a busy family life, so I'm curious about your thoughts as well on how you balance the work-life relationship.
Well, one of the things that's really important to me is at the end of my life, I don't want to look back and regret anything. So, you know, we make very important things in our lives that are not important. And if we stick with what are those important things, and Karen did it, you know, when her son spoke up, right? You know, she realized that was more important to her. And it's not always saying no. I think it's saying wait, because also there's this sense of urgency for a lot of things to get done that really don't need a sense of urgency. So what happened for me was my mom died, and she was a stay-at-home mom, and I was the youngest of 5 kids. And she thought I was working too hard, and I never listened to her because I, like Karen, was moving up the career ladder, was getting everything done. I liked people coming to me. But she died, and it just struck me that the things I would regret were the things that I would miss if I was saying yes and working all the time. So I did not miss my kids' games, piano recitals, orchestra, you know, choir, lots of lacrosse. I can't even tell you how many lacrosse games I've been to in my life. Vacations, made sure, and I was vilified by some people because it was in the 80s and early 90s when you didn't do that. Back then, your car was the first one in the garage in the morning and the last one there at night. And if that's the case where anyone is working today, that is not sustainable. You will lose good people if you treat people that way. So I decided to be the poster child for a balanced career woman role, and took some hits from it, but I don't look back and regret a bit of it. And, you know, hopefully I'm far away from it, but when I'm lying on that bed one day saying, what do I regret? It won't be about being at a meeting. It would be something with my family and my kids. So, and I do want to just add here that this isn't just about kids. Balance isn't just about people that have kids. It should be about everyone, people that want to travel, people that want to do a 5-mile bike ride every night or sometime during the day, people that need that respite from work. So we need to think bigger about what balance means for every individual that we're accountable for in an organization.
That was a great point, Gail, that you threw in, because not everybody on this call is going to be focused on kids. So I appreciate you pointing that out. I'm going to go back to Karen on my next question. Karen, how important in your success do you think was mentorship? And when I say mentorship, I'm talking about it in terms of both being mentored and giving back as a mentor. What do you think of the topic?
Oh, I mean, I think that's, I think it's critical. I mean, I think, you know, you need a mentor. You need someone that can be that person that you can talk to, that you can really bounce ideas off of, can, you know, help guide you in your career path. And choosing that mentor is going to be extremely important too. because you want to choose someone that you can relate to. You want to choose someone that you feel like has the skill set to really guide you and help you, whether it's, as Gail talks about getting a professional coach, or having a friend that has a lot of experience in the area that you're looking for. You have to have that person to pick up the phone and call, to schedule regular time with, because I think that is how I was able to be successful in moving up the ladder and doing different things. And I think being a mentor is our obligation. I mean, I think we're obligated to mentor others. I have probably 4 now people that, look to me for guidance, that, I spend time with, and quality time where they can just talk about anything they want to talk about, how they feel about their job, what's their next step, if they're looking for, the next educational opportunity, next job opportunity. And I feel compelled to always do that, and to always be there for individuals, so that I can help them be successful. And I know in my career there are many people. My job is really to mentor people so they're more successful than me. To get them, at a higher level if I can. And so I've always tried to do that, and I've always had a mentor, of someone that I could look to. It's changed through the years. Interestingly enough, it really sort of depends on your pathway. But there's always been that person that has been my go-to person.
Okay, great. I'm going to push this question to Gail, but Gail, also, if I'm an MHA student right now and I'm about to graduate and get into my first job, and I hear people that are successful talk about the importance of mentors, how do I identify a mentor as well? Maybe you could just throw that in too.
I think that, thanks for that, Sarah. And I love your answer, Karen, is super. First of all, I think that building on what Karen said, it's so important not to have one person that you go to. So your issues, your problems, your challenges in life are so varied that if you have a number of people that you can call, what I use the term advisors rather than mentors, does a couple of things for people. People love to have their advice asked, right? I mean, there's when someone comes to you and say, can I just get your advice about something? Doesn't that feel good? So if you're a student about to go out into the work world, approaching people in that manner, can I ask your advice? Can I ask your advice about my resume? Can I ask your advice about these job applications or these couple opportunities I have? Can I ask your advice? Should I do a fellowship? I mean, if you go out and ask people their advice, I will say they love it. And most people, 99% of people, will make time to give you their advice. That's a little different approach than saying, will you be my mentor, which really establishes a long-term relationship that some people don't want to be in, right? So, then my second point goes back just a bit. If you have multiple people you're asking advice about, people that are in the career you want to be in, people that you can trust, friends, people from your church or your synagogue, people from your neighborhood, people from your book club, people in the workplace, you get to be the one that decides what's the right answer. You take all of that feedback, all that advice, and it's on you, or it's really on you anyway. But if you have multiple advisors, then you get to decide and take the right course.
That's great. I couldn't agree more. I mean, I'm always interested in that, but I'm trying, as we try to put ourselves where I think the majority of people that are listening in today are students. So that's very, very helpful. My next question kind of dives in a little bit to the gender bias issue. So I'm going to go back to Karen. Karen, obviously, as in my introductory comments, it was evident that men significantly outnumber women in leadership type positions in healthcare. Literature, I think, has referred to it as the broken rung on the ladder, on our career ladders that we're trying to climb. I'm curious if you've observed this within your own organization, and how do you think it came to be? And if so, do you have any actions you recommend to resolve the pattern and stop the pattern?
Yeah, I'm going to go back a little bit in time because I think that, when it depends. If you're looking at nursing leadership, then you are seeing a female dominated leadership team. Most nurses are females, and most nurse managers, even directors, are female. And you've seen many men actually begin to break into that, which I think is good. So I'm going to talk about it from both ends because I think it is important that you have nursing as a female dominated group, that you have male leaders in that clinical areas, because even though the workforce may be 70% female, there are still 30% males represented in that. And I know as a leader myself, I try to be sensitized to that. When I'm interviewing, when I'm looking at candidates, to make sure that there are a variety of individuals from a variety of backgrounds that are in the interview process. So it isn't really, to me, it isn't as much about I'm hiring a female or male. I'm hiring the most qualified candidate, but I have to be sure that in that candidate pool, everyone is represented so that I have the opportunity to hire them. Now, if you get to the CEO and the C-suite, the world changes. In the fellowship I told you all about that I was selected to attend, there were 20 people in that fellowship program that were selected to attend. There were 18 men and 2 women. So the goal of that fellowship was to, again, take you where you were and move you into a higher level in the C-suite. And so, clearly, in that selection process, there definitely women were a minority, yet in the workforce in healthcare in general, women are not. So for me, one way that I tried to, I think, help people see that my contribution as a female in that group, I worked really hard. I wanted to be the star pupil. I wanted to make sure they understood, if there are only 2 females, these 2 females are going to do some outstanding work. And maybe next time when you start selecting that fellowship group, you will maybe think a little bit more about the females that could be placed in that work in that fellowship, so that you're working them into the C-suite. So I think my entire career I've seen it. I could give multiple examples of it. I think today it's less evident. I think it's not where it needs to be, but I think that companies are being sensitized enough to it to realize they need candidates, males, females. There are other factors that should be considered, and are trying to get the right kinds of candidates to pick to go into the C-suite. But we as women, I'm going to speak to that specifically, need to be confident enough to apply for those jobs and to think I can do it. And I think that's part of all of our responsibilities, is to be sure that our resume is done well, and that we promote ourselves. And we get out there and say, yeah, I'd really be good for that. And I know when I was my first CEO job, it was 3 people interviewed, 2 males and a female, me being the female. And my boss said, not sure really you're going to be the top candidate, but okay. And I really thought at the time he said that because I was the female candidate. But that being said, I did win over the board, and I did get the position. But I do think you have to be confident in your abilities.
That's great advice, Karen. One thing I like about what you said is you have to apply to even get the opportunity. And so I think a lot of times we as women don't even put our hat in the ring because we just assume that we're not going to get it. And what if you don't get it? If you didn't try, it's kind of like playing the lotto. If you don't play, you're not going to win. So that was great advice. Gail, what are your thoughts on the topic?
Well, I think the question is spot on. Saw many examples of this over the years. Saw many women that were very qualified not apply for a job. And I think that's changing. I think now people get hired based on the results that they've gotten. But I think, and maybe still in some places back in the day, people hired people they were comfortable with. People hired people that they felt would be loyal to them. rather than looking at who's going to get the results that this organization needs. And I still see some of that. I mean, some of my clients, I've helped with a bit of that, in the more recent past. But I think that if you are getting results and you're confident and you build the relationships that you need in an organization, I mean, real relationships, genuine relationships, not just because somebody has a title, but because you have gone to them for their advice, you've partnered on things, you've been team members together, you will have more of a shot. But I do think that we need to ask ourselves, and I was the CEO and president of our regional network of 40 hospitals. So I had both the president role and I reported to a CEO for a health system. So I saw both sides of it. And I have to, we need to be really honest with ourselves and say, do we want that role because it has a title and more money to it? Or do we want a role that makes us feel satisfied and complete and make a difference? And I will just say one, last thing about this, getting a little bit off topic, Sarah, is a leader has two jobs, not just one. It's, the obvious one is to lead the part of the organization they have to success. But the other part of a leader's job is to support and advance and promote the people that report to them. And if you're in an organization where that doesn't happen, those people are going to hire people like them. So a man might hire a man that he's comfortable with. But if that's a leader that understands that, if these 5 people report to me, I know what every single one of their career aspirations are. I know what balance they want in their lives. I know what challenges they can handle and what's going to push them. Then people are going to be promoted and move into roles, not just the highest level role, but roles that that are in a culture where they want to work. And I know it sounds a little, mom and apple pie-ish, but look for leaders that support you and understand you. And when you first meet them, that they ask you, what do you want to be doing in the next 3 to 5 years? Do you want to go back to school? Do you want to have this opportunity? Do you want me to throw these type of projects your way? If they're asking you, then that's somebody you want to work for, regardless of what the title is in that part of the organization.
Yeah, Gail, I like what you said, because one of the things we talk about in leadership class and the MHA program and in public health is we're only as good as the team around us. And so you're absolutely right. Someone who doesn't kind of support and advance the people that are around them and know what their career aspirations are, then it might not be the best place. The other thing I like that was talked about was as we try to equip our students with what they need to be successful to get out there into the workforce, I think driving results is probably the #1 thing that we need people to do. And so I do think that's important.
And I would just add to that point, Sarah, if I may, that people that worked with me that were getting results had the most flexibility in their day and in their work week. The more results they got, I don't care if they were there at 8 o'clock in the morning or 10 o'clock in the morning, because results were what we were looking for. So results equal flexibility too, is what I wanted to say.
Right, completely. Kara, do you have a question?
Yes, we have a question that came in on what would you suggest to new and emerging young leaders to manage expectation versus performance in a workplace that has changed so much post-pandemically?
So managing expectations versus performance in this kind of new era way of doing things. Karen, do you want to start?
Yeah, I think that, the post-pandemic, I think the world has changed some in healthcare. I do. I think that we think about things a little bit differently. I think we're a little bit more focused on, how the the rest of the world, impacts us, the emergency management piece, everyone was not prepared for the pandemic. And, now we're very prepared. I think we have evolved, we have created plans that hopefully will better prepare us for the next time. So I think in terms of expectations for someone getting out, finishing their MHA and getting out and seeking a job, I think, I don't really think the expectations have changed. I mean, I think that there's still that high level focus on back to, I think what my colleague Gail said is it's all about results. It's all about what you're capable of doing. It's all about demonstrating that you can get results. And so I don't think the expectations of leaders have changed. I think maybe a little bit in terms of you have to be really good at change management, of understanding that, from day to day, things are going to change, and how, as a leader, are you going to be prepared to do that with the people that work for you and with you? But I think basic expectations are still goes back to, what Gail described as, can you get in there and can you get results, and can you speak to how you're qualified to do that?
Mhm. Great, thanks. Gail, do you have anything you want to add?
Yeah, I would. I think in addition to what Karen said, that the one thing that I think is drastically different now post-pandemic is the hybrid workplace, or the still primarily virtual workplace, really hinders one's ability to build relationships with people. Anybody that reported to me every month in our monthly meetings, I would say, who'd you build relationships with this month that are going to help you get things done? Because we don't do anything alone, right? We don't accomplish anything by ourselves. And so that is one of the biggest differences, I would say. And so people have to work harder about building relationships in the hybrid work world. And the young people have to be the ones to reach out to the other colleagues. That you cannot wait for someone to reach out to you. You have to reach out and you have to say, hey, can we talk about that meeting after the meeting? Or can we grab a cup of coffee and talk about this project that we're both working on, and build relationships in a manner that, again, makes everyone successful in the long run.
And I would add to that, I think, that is spot on. We do Zoom, we did Teams, we did everything, but personal interactions almost entirely in some areas went away for at least a short time period during the height of the pandemic. And I'm not sure we're there yet with remote work. I think we still are going to continue to see remote workers. And I can't agree with my colleague more about, building relationships is going to be much more challenging post-pandemic. So that's an excellent point. You really need to think hard about, when you get into the workplace, what exactly you can do to build relationships. And it's not going to be across the Teams or the Zoom meeting.
Yeah, and not just in the workplace, but in the world right now, loneliness is one of the biggest factors that are affecting people's health. And a lot of people are waiting for someone else to help them with that versus picking up their phone. And I know, like my 20-some-year-old kids, they don't call anybody on the phone, but they can text people, texting someone, emailing them, taking that risk, going outside your comfort zone and making the call or the text to connect with someone and build that relationship is so important right now to everyone's health. And believe me, that person is going to be ecstatic that someone reached out to them to build a relationship.
I agree. I also think for myself, I've taken for granted the fact that I already worked here and I had relationships established when COVID hit. I can't imagine starting a new job and not knowing any of the people or the players and trying to build relationships if people are hybrid or remote. So I think that was a great question, and I appreciate the answers. Kara, do we have another question?
We do. How do you handle any challenges that arise from being a woman in the lead?
Gail, do you want to start?
Challenges of being a woman in the lead. Well, I would say challenges as a woman are really somewhat the same as challenges of a man from my perspective on this one. To be a leader, people have to want to follow you. Otherwise, you're off on your own doing something by yourself. And if you're not a leader that cares about the people that you work with, again, this goes back to what kind of person you are, not just what kind of leader you are. If you're not a person that they think cares about you, gives you recognition for what you've done. I mean, how many of us have had somebody else take credit for some work product that we have produced? I mean, I don't know anyone that couldn't say that that hasn't happened to them. So you have to be the kind of leader that promotes, not just in the title sense, but in the, the name, use people's names, go to a meeting and say, hey, Sarah produced this for us. I'm just the one standing here bragging about what she did. Be that kind of leader. And I think the challenges of people not wanting to follow you start to fall away when you act like that kind of person, not just that kind of leader.
Well, I like that because I'm okay with all of you giving me all of the credit anytime. Just kidding. Karen, do you have any thoughts?
Well, I would just add, I agree with that. I think leadership challenges are leadership challenges. It doesn't matter if you're a female or a male. And I think that, to be a good leader, you have to be thinking about the team and how the team interacts with one another and supporting that, as well as, setting the vision. I think as a leader, sometimes we don't set the expectations, the goals, if you don't set that, people don't know how to follow you. So I do think one aspect that as a leader, we need to, that's a challenge. If you're not setting the vision, if you're not setting the strategy, if you're not letting people know where you need to go, people can't follow you. So I think that's just one tidbit, male, female, doesn't matter, is just remember as a leader, you're the person who sets the stage for where everybody needs to be, and you have to care about them in the process and support them in the process, but they need to understand the goals or the expectations.
And maybe,
And can I add, Sarah, just
Go
quickly, as a leader, ask yourself every evening, or maybe at the end of the week, what are people saying about me this week that I'm accountable for? Because we tend to want to ask ourselves, what do the people I report to think about me? But what are the people that you're accountable for, that you're leading, think about me? What would they say about me? And I just think that gives us a lot of insight about whether or not we're going to be able to lead.
yeah, I would agree with that. And I think I liked, especially if you're leading and nobody's following you, then you're taking a walk on your own. So I like that thought process. Kara, I think we have one more question in the chat.
What key leader qualities and characteristics have carried throughout your career, and how have you best implemented those?
For me, I think I alluded to a little bit, I'm a nurse. So I think for me, it's having a caring presence. And I think Gail's, she's speaking to that as well, talking about caring, but you have to care about people. You're not going to be a good leader if you don't care about people. And that characteristic, care, compassion, trying to understand, I think that's essential. I think if I'm not a caring, compassionate person, I shouldn't be a leader, because I'm not going to be effective at my job. I have to care about, the job, the vision for the job, and I have to care about the people who work for me. And I have to care about the people I impact by the decisions I make. So that is one characteristic for me that has carried me through. And anytime when I think, well, which way should I go? There's a decision-making point for me. I try to think about two things. How's it going to impact my employees? And how's it going to impact the patients that we serve? And if I think through that, then I'll make the right decision. And that I think for me is the key thing for me that I hope makes me a good leader.
Great. Gail, do you have anything you want to add?
Sure. I mean, I not much beyond what Karen said. I think she hit the nail on the head. I personally am a very numbers-based person, financially based, but that's what worked in my role. And I recommend that people do what I call read the room. read the room in any situation. You ask yourself, what does this situation call for? Because it's not, one size fits all. And some situations call for being very numbers oriented, like my situation did, very financially. Are we going to make money on this significant investment? Are we not? Or, are we going to impact patients? Are we not? But other situations, when you read the room, that you have to morph. You have to be a bit of a chameleon as a leader. Not every situation is going to call for maybe a financial issue or a quality of care issue or a patient satisfaction issue. They're going to differ with different audiences and different people. And I think a really good leader, a characteristic that I recommend people work on is being able to read the room, because ultimately you want to be in the room where it happens, right?
Yeah. I have a question I want to jump in on. I think most of us, if not all of us, could probably look back at a leadership or management thing that we were involved in, large or small, and say, gosh, I wish I could go back and handle that in a different way. Do you have any personal examples of something you could reflect on for us? Gail?
Oh, sure. I have many, but I'll just cringe and bring up one that was very early in my career. In fact, I will just say to the audience, like, the mistakes I've made have made me better at what I do. So no problem having mistakes. But when I was very young, like many of the people on the call, I was a very junior hospital administrator and hadn't really read the room, right? And one of the other very senior administrators said to me, like, okay, you're new, you have a fresh outlook on things. Could you just kind of take 2 weeks and assess everything that you see and come back and tell us what we need to do better in this organization? So I did what that person asked, wasn't my boss or anything, came back with 2 pages of things that needed to be fixed in an organization that all these hospital administrators were responsible for. Huge mistake. Huge mistake. Came off as a know-it-all. Just didn't read the room. It's much more important to be humble and ask questions rather than point out what's wrong in a situation. Questions are much softer, make people less uncomfortable. Questions like, why do we do this way, is just a question on my mind versus this is wrong and this is how you should fix it. So huge mistake, learned from it. Thanks for that question that makes me cringe to this day.
Great example, though, especially for people starting out in their careers. Karen, do you have anything you wanted to share?
Oh, I have multiple things over the years where, I cringe and go back and say, I wish I'd done that differently. And to Gail's point, I've learned from them and try not to ever do them again. But, a similar kind of situation to Gail, is sometimes you go in and but no one even asked me, but I thought I knew how to fix something. I looked at it from an outside lens. I wasn't part of that unit, but I thought, oh, if I could only be in charge, if I could only be in charge, I could go in and fix all of these things because I knew what was wrong. When at the end of the day, it's the people who do the work that know what's wrong. Mm-hmm. And your job is to try, and when you go in and do that, not just know it all, but I didn't, nobody even asked me to do it. It was my, my sort of thinking that I was smarter than everybody in the room, and got me in a lot of trouble. And I had to go back and say, wow, I'm so sorry. I didn't really understand. This is how you did this, or that, on your unit, it can't work because of this. And so I had to eat a lot of crow to really gain their respect and be able to get back into their good graces, to be a good leader to them and let them help solve their problems.
Great, thank you. I'm going to summarize a question that came in. I think it went on, Karen, you kind of talking about your postgrad fellowship experience was influential in developing your understanding of healthcare business and propelled you towards success. But what are some ways individuals can develop their business understanding in healthcare? Is it more the pursuit of formal certifications and online classes? Or what would you guys suggest for a new employee kind of working in your organization?
Well, business acumen is very important. You really have to understand the financial piece, because you have to understand why decisions are made. And so I think whether you're taking an online class or doing a continuing education, or really being willing to ask questions of the financial team, you really need to be able to do all of the above. From my perspective, that's key. Having that, business acumen in the healthcare industry. You can't go at it, just take an online course and think you know everything. I think it takes a multitude of factors. And then you have to actually be willing to sit down with finance people and ask questions so that you understand.
Great. Gail, do you have any thoughts?
Just would say you need to read everything. I don't know how many people I've interviewed over the years that didn't know pretty simple things about our organization that they were interviewing, hadn't read, the mission statement, hadn't been on the web page, didn't read the latest news clips about it. And that doesn't end once you get the job. That should be the case, throughout your time at that organization. And then just one little slightly different thing. Sometimes you can't get access to be in that financial discussion or be in that meeting about something important. But if you, as a young executive, volunteer in your community for a not-for-profit and maybe get on a committee, get on a board, you get to see their finances. You get to see how an organization runs from a different perspective, and that brings you insight when you come back to your bigger organization. And you don't know, you're not always on a board or but there's a food bank, there's a Y, there's a number of places in your organization that you could go get on a committee and help. That's going to train you for something someday, you don't even know what, in your own organization.
Great advice. We're bumping up against the hour, but I have one last question because I know there were some students that were curious about this. We talk a lot about dress for success. What are your thoughts on that in the professional world, and especially for young people coming out of school, young, mid-career, whatever, but they're coming out of these degrees? Do you have strong thoughts on dressing for success? Karen, I'll start with you.
Well, yeah, I think you have to dress the part. I mean, I think it's basically required. I mean, I think over the years, especially with, again, remote work, there's a lot of down, dressing down, and I think it's okay when your hospital does that, and it's fine. But if it's wear jeans to work day, you don't want to be the one with, the holes in the jeans. I mean, you have to look the part. People will take a peek at that, like at the very beginning. And I think, you have to look the part to be successful. I think that's still essential as it used to be. I don't know what Gail thinks, but.
I agree with Karen. This is another one of my read the room answers, because every organization is different. Apparently people don't wear ties anymore. That kind of took me by surprise. But if, some places, tech places, some others that I work with, the dress code is completely different, but always start out dressier than you think you're supposed to be.
Yep.
Always start out and then read the room and you'll know how to dress.
Agree.
Great advice. That's perfect. Thank you. Well, it is 1 o'clock. I want to be respectful of people's time. I want to thank you to our panelists, Karen Bowling and Gail Marsh. Thank you so much for being with us today. I think we've all learned a lot, and your words and wisdom are invaluable. I wrote down a bunch of notes just so I could remember them. I just want to remind everyone really quickly that this program was presented by the West Virginia ACHE chapter and the MHA program and Upsilon Phi Delta, and has been approved by ACHE for a total of 1 hour of qualified education credit. The participants in this program, though, who wish to have it considered for ACHE credit should list their attendance in the education section of the membership site when you apply to ACHE for either advancement or recertification. If anyone has any questions, they can contact me directly, and I'm happy to help navigate the system. But thank you again, Gail. Thank you, Karen. And I hope everyone has a great weekend.
Thank you.
Thank you. Take care.